All right, so we're called for a 26-year-old male been involved in an assault, and we are approaching the scene now. So we see the scene, we're looking, we see the one patient laying on the ground, we have bleeding next to him. We're going to get our general appearance as we approach. The scene does appear safe. PD is here. We have other responders as needed. So as of now, we do not need additional resources. So we're going to approach the patient to see if our patient responds. Sir, are you okay? So the patient moans, and so he responds to verbal stimuli. As we approach, we're going to look for, get a general appearance of the patient. We have bleeding noted from his left leg. We have bleeding from the head. We're going to come up and perform our primary assessment. C-spine. Sir, can you hear me? Can you hear me? Okay, so airway is open and clear. If it wasn't, then I would make means to clear it, suction, whatever. So we have some bleeding, but it's not uncontrolled. It's more venous bleeding. Patient is breathing. Checking a carotid pulse. Patient does have a carotid pulse. So we're going to, until we confirm, we're going to hold C-spine, keep him from moving his head. I'm going to hand this off to my partner. So that completes our primary assessment. I also need to determine load and go status. So is patient's altered? We have bleeding wounds, not uncontrolled, but we're going to go ahead and, with this altered mental status, consider this a load and go situation. So as we continue to perform, lead into our secondary assessment, we're going to do a complete head-to-toe assessment. We're going to check the posterior neck to see if we have any deformities or step-offs on the cervical spine. Check his trachea, assess for midline. I'm going to check for any JVD. As we get here, we're going to palpate his chest. I'm going to expose his chest to make sure we don't have any obvious wounds. Palpating on assess for chest excursion to make sure they're equal. This time we'll listen to breath sounds. Breath sounds are clear. Listen for their heart tones. Heart tones are clear, non-muffled. We're going to continue with our secondary assessment, palpating his abdomen, palpating all four quadrants, noting any distension, rigidity, or distension, or rigidity, or tenderness. As we palpate his pelvis, we're going to push inward and downward. Don't note anything. We'll check symphysis pubis. Checking his right leg, assessing his femur for decap BLS TIC, which is deformities, contusions, abrasions, burns, punctures, penetrations, lacerations, and swelling. Check his lower leg for the same. We're going to assess pulse motor sensory. Check cap refill, see if we have sensation to his right leg. Assess his left. His left, looks as though we have an open wound, possible open fracture. Bleeding is controlled. We're going to assess his left lower extremity, assessing PMS, cap refill, and sensory. It's his upper arm. Assess his right arm. Check cap refill, pulse motor sensory, and we're going to do the same for his left. So with this, we're going to, again, we're calling a load and go situation. We did that in the primary assessment. We're going to, on a headman's count, we're going to log row on the unaffected side. So my partner count, 1, 2, 3. I'm going to log row. Going to assess his posterior back, check his flanks, his buttocks, see if we see any bruising, deformities, or anything like that. Check his scalp. We're also going to go in and assess his, where we would log roll onto a backboard, or we're going to assess his face, checking for any instability, check his pupils for pearl, check scalp, re-inspect the airway to make sure it's still patent, he's breathing, secure him to the backboard. We'd have a C-collar in place, secure him to the backboard, place the CIDs in place. We'll manage the open wounds in transport. At this time, we'll try to get a sample history if we know of anybody. So signs, symptoms, allergies, if there's any medications, past part and medical history, last oral intake and events leading up to it. There's no one here to ask. We're going to look. We do not see any alert bracelets or necklaces. So we're going to get vital signs, get blood pressure, we're going to get a pulse rate and respirations, SpO2, and we'll continue loading the patient and reassessing it every 5 minutes during transport. I'm going to reassess airway every couple minutes, and breathing. If breathing is ineffective, then we will assist ventilations.